Thank you, everybody, for showing up to our Heart Month symposium here. I assume most of you know who I am. Dave Baker, one of the cardiologists here for about forever, but not as long as the man sitting next to me, okay? This guy's been here. He's a legend here in cardiology. So thank you very much for joining us. I definitely don't need to introduce our guest here. This is Dr. Chryssos. He's been a fundamental part of cardiology care here in this market for decades, and then has a little bit of a personal story he'd like to share with you about where he's been the past 8 months. So again, welcome home, Dr. Chryssos.
Thank you. Thank you very much.
So I'll just start off. Doctor, when did you come to Carson City?
I came in 1993, January 15th. I started in 1993. It was a snowstorm when I came to town. So I learned about Washoe Valley being snowy. You couldn't see your hand in front of you. At that time, originally we stayed at the Ormsby House when we came, but now that's nobody. It's closed. I left Manhattan. I was at New York Hospital Cornell, where I did a 4th year of angioplasty and stenting. Stenting just started back then, but I just found Carson City had everything that I wanted. I wanted a nice place, and I went to a conference in California, and I looked around, and it was November, and it was a sun. I said, what the heck's this? They said, if you want sun, there was a guy who says, come to Nevada. And it was one of my partners, future partners, Frank Kelly. And they offered 12 weeks vacation, which was good. But I said, let me go to Greece once a year, because if you would put that in there, because lifestyle is everything. So I said, put in a contract. They said, there's no angioplasty in Carson. I said, doesn't matter. I like the small city, but lifestyle is everything. So I gave up angioplasty that I trained for 2 years. But it offered everything I wanted. It was small city, the vacation I needed, the administration, which was good back then and now, and my partners. So it wasn't Reno. They had a fancy office. I had a little office, 4 walls with cobwebs.
So how much cardiology was in Carson City in 1990?
Before I got there, Dr. Field was the only one. He had been there 6 months. And one of my partners, Steve Bruce, was there for a couple months. He left a year afterwards. We started out, we had no nuclear machine. So I told them, I said, you need a they had a cath lab that we put pacemakers in and did caths, but we had no nuclear camera, just a treadmill. So I said, look, you need a nuclear camera. So we convinced the board to buy one. And then they saw how much volume we had. But we were busy. I was in the ER. Back in those days, we had no angioplasty. So I'd be in the ER doing 2 acute MIs in the middle of the night, Thrombolytics were the thing back then. So now it's a lot easier. They fixed it with a stent, and then you had to fight the arrhythmias. When the artery opened up, then you fight V-fib arrests and bradycardias. So you were up all night. I was on call every other day for about 10 some years, and every other weekend, because it was me and Dr. Field. Then the hospital was just too small. They decided to build a new hospital. At that time, one of the board members got off the board, and they interviewed people. And I was the only physician on that board after that. For some reason, there was no doctors on the board. Then I showed them that we need physicians or some professionals in the board, because nurses, doctors, they know about hospitals, but businessmen, we had a guy who owned a hamburger joint, some school teachers, state workers, because back then, it was a public. I had to be voted in by the public. I still have the things with my name on it that I was voted in 2 times, because I had to run for office for the board position. Then we built this hospital here. There was 7 of us on the board at that time. We decided we needed a bigger hospital. We were there for the design and building of this facility here, which changed everything. Although the people in town don't realize it. Now we have angioplasty, which is, before we used to fly them to Reno in the middle of the night. Helicopters would come in, we ship them to Reno. People would arrest them upstairs. And so now people come to get angioplasty stent. We had no bypass. People get bypassed here. A lot has happened. This new facility provides such new care to the community. I just hope they appreciate the amount of care that we provide here. So since then, I've been working. I was first with Sierra Nevada Cardiology. Then they decided to sell, and my partners, I told them, I cannot work for Renown. We will not survive in Carson. We have to work for Carson. Ned Epperson, the administrator, had always said, "Can we, come to a Carson?" So I told my partners, the CEO was a Washoe guy. He says, "No, they can't go. Washoe's got to bless it." And my partner said, "No, they don't own us yet. We're cutting them loose." They voted, and that's why we came. The four of us came to Carson, and
That was back in 2010.
yeah, yeah,
Really established our own group.
we then and even then, the difference between Renown and us was known to us because we got paid appropriate for. They bought us. They got paid low end. So you can see the difference, even how they treat their physicians. When people come for interviews, I tell them this is a great place to work. Administration works really well with our doctors here, and I'm very happy.
So you've been practicing cardiology for 30 years in Carson City. So can you go anywhere in town without seeing?
Yeah, pretty much I go every place they know me,
Yeah.
When I lost a lot of weight, I was on this crazy diet. Protein, no fat, no. I was on the 180 pounds, and I went to the post office. She said, "Doctor, are you dying? You got cancer?" I said, "No, I'm on a diet." But everybody, the crazy part is somebody and, "Hey, how are you?" But then you try to place the people. And then, you have to know, remember that if somebody passed away, you don't say, "How's your husband?" No. So it's kind of tough being out there with all those people. But yeah, I take care of the parents and the sons of some families. So I've been here a long time, and the hospital has been my life. I mean, from 8 in the morning until 5 at night, every day for 5 days a week. So that's.
So years and years in cardiology practice, and then so when did you sort of start to realize you were having a personal?
My mother had a cardiomyopathy. My mother and my grandmother, I suspect my grandmother, she was in the Greek islands, she always had severe edema and cellulitis on her legs. Her legs were brown, just like mine are now. But she died from skin cancer because she had blonde hair, blue eyes in the Greek islands. So but she never got to be beyond that. But she had some kind of heart failure. My mother, they told her she needed a transplant, but she says, "Nah," because they told her she had to live in the States forever back in 2000 sometime. And she says, "No," but she was lucky. Coreg came out. They put her on carvedilol. They put her on all the new drugs. They gave her, she was a responder. They gave her a biventricular defibrillator. She responded, heart function normalized, and she died at 83 from cancer. But me, I started knowing it in my I used to run 5 miles a day when I was younger. Then slowly and slowly, I would notice my feet swelled, and I was short of breath with exertion. 2000, maybe 15, around there. My physicians noticed that we started treating. My EF was 35, 40, 45, then went to 30, then 25. We put a defibrillator in, and I was on all the medications. I was on the beta blockers. I was on Entresto. I was on spironolactone. I was on the latest diabetic drugs, Farxiga. So I was taking everything that's supposed to help, but I was a non-responder. I worked, and then one day I was shoveling snow, and my wife, thank God I was by the garage, and I went down and hit my back, landed on the garage. My wife, "What's happened to you?" I said, "I don't know, I just got weak and lightheaded." She goes, "Go to the hospital." I said, "Nah, I'm all right." So the next morning, I get a phone call from Jessica in our Pacer clinic. She goes, "You got shocked. You're in ventricular flutter, which is almost fib at a rate of 290, and it shocked me out of it. And it saved my life." Then we started amiodarone. We had 200 twice a day, and then we went to 400 because I had arrhythmias. And subsequent to that, I had AFib. I developed AFib for the first time. So I went downstairs, and they shocked me. First in the outpatient. Then I went to the ER. 2 times I converted. Then the third time, I did not convert. So I was still short of breath. I could barely walk across 2 rooms. So I saw my patients walking room to room. But
so you went from running,
5 miles
routinely to where you couldn't walk 10, 15 feet without having to stop.
And then I went and got for AFib ablation to improve my cardiac output. But then At that, so I rested on a table on them because they gave me
in Utah, right? So at this
Utah.
point, you went to see the University
Yeah,
of Utah.
I was here. I went there
Films,
for an outpatient procedure. I left on a Wednesday, June 5th, I believe it was.
which turned out to be the last time we saw you for
Yeah,
6, 7 months. Yeah.
yeah. Then they shocked me out of it. Obviously, went upstairs. The plan. Then they give me
So here's what he tells me about this. Okay, so he he goes to get this ablation. It's an outpatient procedure. It's very common in cardiology. And I'm talking to him afterwards, and he's going, "Yeah, yeah, my blood pressure dropped for a little bit, and they did a little bit of CPR, and then I went, that."
Yeah, there was the things that being a cardiologist was different for the doctors there because they're not used to that. Let me just turn this thing off. Because I knew everything was happening to me. I get upstairs and I see the VTAC going on, and they start amiodarone on IV. Then wouldn't hold it, lidocaine. Then I was sitting, and I said I'm getting a little dizzy. They brought the defibrillator, they reprogrammed it, and paced me out of it one time. Another time I was in VTAC, but with amiodarone, my threshold, my level of the shock was lower. So I didn't get shocked. I said, I'm going out. I went back, but there was a cardiac fellow outside, came in and popped me externally. Then he reprogrammed the defibrillator and put in an Impella because my pressure was so low. I kept having VTAC, sustained VTAC. Talking to my daughter with the Impella in, and it kept my pressure up. And I saw the VTAC on the monitor. I said, I got to hang up. I hung up, and it went boom, and it shocked me. And I said, okay.
So again, at this point, your heart is to the point where it's
right. It was scarred. It was scarred. My heart. This is an inherited condition. My mother had it, but she was never tested. I have been tested. It's an inherited tight mutation, which is a known dilated cardiomyopathy. The tip of the heart was all scarred. So I took that heart as far as it could go. I could not survive without the Impella. So the Impella, after I got shocked, I didn't get dizzy or lightheaded because I had the Impella in, keeping my pressure perfect. And I walked around for a couple of weeks.
So I assume most probably know what an Impella is, but it's essentially an artificial heart. It's a device they can put into into your blood vessels that literally takes over.
It goes into the heart, it's like a little pump, and it pumps the blood, helps the heart squeeze, but it pumps the blood out. So it kind of does the heart, for a short time. Then they said to me, well, we could put you on dobutamine, and you can go home on the dobutamine drip. Then I went into VTAC again. They said, okay. And then the question was an LVAD versus a transplant. An LVAD is a device you wear with a battery. It's called destination therapy. That really now they're showing that people do improve and come off those LVADs. But currently, it's they're really, some people don't want a transplant. So they do an assist device and people function good. I mean, but you have the risk of infection from the tubes.
So how did that discussion go? So you're to the point where it's either you need to have a true artificial heart or you need a transplant.
I told them that I really, an artificial heart for me would not be ideal because, I mean, I go to Greece and I want to go swimming. I can't go with a machine in, and I knew it's a destination where, give you an example, Dick Cheney got a transplant 20 years ago and he's still alive. Chelsea and the twins, they're here after how many years? 17 years, 18 years. 22. I'm sorry, yeah. And I talked to Chelsea. I called the girls up. I said, what does this mean? I said, they helped me a lot. I said, this happens. Don't worry about it. You're going to get stronger. I thought I could never walk for a year. I was so weak. When I left there, I mean, they got me up walking. I couldn't walk 20 feet. I couldn't lift my hands up.
So what? So you're considered for the options.
Yeah, considered for
transplant.
I told them, yeah, but they have to wait. So
how long was the wait?
About a week, because the Impella put me at the higher level. And I got my transplant 4th of July. Okay, and I had a kidney the 5th because the cardiomyopathy caused the cardiorenal syndrome. So my renal function was bad. So they said, well, I said, I don't want to get a heart. You need it on dialysis. They said, no, the heart trumps everything. You get a heart, you get a kidney with it. So
how do they tell you that?
They walked in. Well, it's a committee. I didn't think I was going to get it because they had a vote on it. They said, your weight is a problem. You're at the max. Uh, Most people who get transplanted gain 40 or 50 pounds because they're on prednisone and they're famished. And I promised them, I will not gain the weight. You, I guarantee you, I will not gain 40 pounds, maybe 5 or 10, but I will try to go down, as much as I can. And I'm still trying. I got down to 230. I'm up to 35 now, so I'm going to try to go down to 220 by dieting and exercising. But so they had a committee, and it was not. They had Dr. Seltzman, the cardiologists that come here and visit all the time, Dr. Carter, Dr. Fang, Dr. What was the other one? Dr. Dracos, and I saw Stellick. I saw all those, every one of those people. They vote with a committee with uh, sociologists and all kinds. It's a big committee, and I didn't know what would come out, but the docs fought for me to get the heart.
Mhm.
And finally, they came and told me, yes, okay, you're a candidate, you're on a waiting list. And I'm just sitting in the ICU. They're walking me around with this Impella, walking around. Um, they're still very weak. I mean, just to walk, they were rehab helped me before and after. Rehab did everything for me. They got me up walking, which is,
At the
you,
time when you were with that Impella in, you would go into ventricular tachycardia, right,
oh
and not
yeah,
even feel it
yeah,
at this
yeah.
point.
But
So
they maxed everything out. They had me on lidocaine and worried about seizures
yeah,
because they maxed the lidocaine. The EP guy, Dr. Constantinidis, who's another Greek, Cypriot guy, Greek guy, he came up and he says, "Look, we're going to try to push to the limit because if I take you to the lab to ablate this, you may not survive it because my heart was so scarred and so thin." So that's when everything worked out.
so you're in the room on the Impella. You know you're on the list. You don't know when you're going to get that heart. Who comes into the room and tells you that you got the heart?
Well, first the nursing staff said, "Hey, you got to give good news." Then the doctors came later, but it was the nurses who told me in the beginning. They came and then the doctors came in and told me that the decision has been made that I would be a transplant candidate. Um, and then it's a wait. Sometimes they told me you may wait a week, 2 weeks. I think I waited 2 weeks. I can't remember exactly
So
when.
on July 4th, when you found
July
out,
4th.
how did that go?
Uh, it
I mean,
was,
how they tell you it's
when
time
they
to go to
say
the
we have
OR?
a heart, they told me that the day before, because it was the 4th of July, they had to bring the heart. So they don't tell you who it was, but some of the staff told me the heart came from a 29-year-old person. That's all I know. So 4th of July, you know, it's a tough thing to live with that someone died for me to live, and I have to think of that all the time and take care of this heart. It's been a gift to me. I can't just go out and abuse my body because this gift was given to me to live longer, and it's my job to do everything I can to prolong this life and this heart. Uh, 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 that's kind of a psychological part. But it's the way you look at it. I've never dwelled on it. I just say, okay, I understand it. I've seen people die here, cardiac arrest within. I mean, I see things differently as a physician and as a health professional because we deal with this all the time. But right, right. That's the way I see it. But yeah, it's sad. But that's why all my kids they became organ donors. I'm going to change to an organ donor for whatever part they want to use for me because it helps so many people. It's changed my life. I wouldn't have survived it. I could not live without the Impella. It's either that or the LVAD. We have patients here with LVADs. Um, so it was. Then after before the surgery, they're wheeling me down there. I'm going, okay. So I said the Lord's Prayer on the way. What else can you do but pray? There's nothing more you can do. I've been cast, multiple times. They would do heart cats. And after the transplant, woke up. Then I had pneumothorax, and then I had pneumo here under my a leak, the air leaked out under my skin. Then they put an external one. So I had my complications. I arrested, I guess, several times on them. I had pneumothorax. Was intubated. Then after that, then you get a little delirium. You don't know where you're at. It was, but the nurses were. I mean, I don't know. I was just out of it. I had, bowel problems and all because it kept giving me NG tube and oh God, and it was just. But I don't remember most of it. I know it was unpleasant, but your body forgets most of those things.
So
Then,
what could you do physically right after the bypass or the
oh,
transplant?
after that, I was so weak because I was in the ICU for like 6 weeks. So, like I said, the people who got me back was the rehab people. Without rehab, I would not be any place because I couldn't. I couldn't even lift my hand to feed myself. I couldn't get up out of the chair. They had to help me get up. I go to the bathroom with a wheelchair first. Somebody would wheel me, and then even I would take. They have rooms. I would take. I would sit and take a sponge bath with a shower on top. Uh, couldn't even stand to shave. I mean, then I went to rehab. I was discharged, and I went to inpatient rehab for 2 weeks. So I would do 3 times a day. I would do rehab. But I would do, start walk. I couldn't even walk. Well, from here to there was as far as I could go in the beginning. Around the circle, they have a circle you go around with a walker, not alone. Then gradually I got stronger too. I could do one. When I left the hospital, I could do just one turnaround. Then they didn't send me to cardiac rehab. They sent me, I think is a better way to go, regular rehab. And they got me walking. They worked on my legs, on my balance. They would stand me up and do things to keep me occupied so I would stand. That was because I couldn't stand for more than a minute. The things that you take for, you know, for, what's the word?
Granted.
For granted. The things you take for granted, like for a man, standing up to urinate. I couldn't do that. Like taking a shower. I couldn't do that. It's so every little step was an improvement thanks to the rehab people. You get the heart, you get everything. I take 18, 20 different pills. I take prednisone every day. I take 2 anti-rejection drugs. I take 2 of them for mycophenolate twice a day. I take tacrolimus every day. I take calcium. I take magnesium. My tacrolimus eats the magnesium, I guess, and I'm taking 7 pills twice a day for magnesium. But hey, that's what you got to do. They said no alcohol. I said, well, I don't need alcohol. As long, there are certain things that happen with a transplant. I have to wear a hat. The reason is the risk of skin cancers, they told me, is 30% because of the drugs decrease your immunity and your risk of skin cancer. So I wear sunblock and I wear the wide brim hat. Those are things that, but the rehab people, I had to drive, so you can't go out driving unless you pass a test from the rehab. You sit there and you stay, and they do hand-eye coordination, make sure you can see things and then pass a real driving test on a computer. So I did all that, but rehab really, after the surgery was complete, everything was fine. Then what do you do? I told Dave when I talked to him, I said, I don't think I can walk for a year. There's no way I could do it. I felt so weak. And I told my daughter, I don't know if I'll make it to your wedding for a year because I don't believe I can walk that. But it's unbelievable. And the people in rehab in the back really appreciated everything they did for me at the rehab because that's what got me back.
So what are you doing now? What can you physically do
Now
now?
I can walk for an hour on a treadmill. Now my heart is denervated, so I don't jog because my heart's denervated. It can only go up to a heart rate of 150 to 125. Chelsea tells me in time it'll go higher. Right. So I can get my heart rate up to 120. If I walk a little bit, it goes to 110. I don't get short of breath. I get a little short of breath if I walk a little bit more, but I can walk for an hour on a treadmill without a problem. Because I got the condition that my arms are so small that they couldn't find a vein. So I started doing curls. So now they have huge veins that stick.
Another quick story. He came into the office just a couple of days ago.
Yeah.
We were talking. You were talking about working out and stuff, and you were wearing a T-shirt at the time, if I remember. And you started talking about your biceps, and you just went and flashed that old gun show, man. And
Well,
he's got biceps. He
yeah,
has nice biceps.
because my body just, everything is just gets, you got to tighten things up. So now I found yoga and stomach exercises every day I do. I couldn't do it all those years because I couldn't walk. I would walk. I mean, people didn't notice it. I would come in and go to the get my list from next to the cath lab. Then I would walk to the ICU and sit. Then from the ICU to tele, that's a big deal. I would stop halfway outside the surgical area and sit down on a ledge there. Then go to tele and sit down. So though now I can walk. When I'm walking through the airport carrying my wife's handbag, which is pretty heavy, and a violin case, and she's dragging behind. I said, "What are you doing?" So it's really I haven't felt this good for ages. So um, I feel really good. I'm back to where people say to me, "Well, why didn't you retire?" I said, "Well, I want to go out on my own condition. I don't want to say my illness made me stop, and I feel I want to work. I can see for several years, see patients, and then when I decide, okay, but I don't want to go out and say, well, I had a heart condition, I had a transplant, because I'm functional. They fixed me. I asked them, can I go back to work? They said, sure. Wear a mask. So if I'm close to patients, I'll start wearing. I don't go to crowds. I wear a mask at the Walmart and all the places when I'm close to people. And that's it. You have to worry about neutropenia. My white blood count gets low. So my CMV virus, I was exposed to it previously. I don't know where, but because your immune is low, that came back and it went away after with antivirus. Now it came back. I'm on antivirus now, but they call me up. Your calcium is low, so I'm taking 2 calciums in the morning, 2 at night. I get blood work done. Now it's every week to check my white blood count and I get CBC, electrolytes, tacrolimus levels, CMV levels, and every 2 months I'm getting a biopsy. So you see, but I do it in the old days. I said sedate me because you sit around for all day long. So under local, I said no sedation. So they do the biopsy. They do a right heart cath. They do a biopsy. Then I get up and walk out. But it's they've done this. I usually stick around. I was living there, had an apartment, but now I'm going to go and at least stay at least 1 day before I come back because I just want to make sure if there's any problems with this. They always do an echo afterwards. So I go my visits. I see the doctor. No, I get my heart cath. They draw the blood from here. Then I get an echo afterwards. Then I see the cardiologist. Then because I see a nephrologist as well, I see him the same day. I see a nephrologist. So 1 day I see everybody, and then I'm done. But the things that also impressed me was the insurance from this hospital. They covered everything. Um, it had to be several 100,000 or more, maybe 500. I don't know how much. But the only outpatient, and after I got outpatient procedures, then I paid 20%, which is fine. And everything is, my drugs are all covered. Um, they have a mail-in pharmacy. I use them. I could use Costco if I like, but they have their own pharmacy, so I use those. But yeah.
So, I mean, obviously, life-altering experience for you. Can you reflect a little bit on the organ donor network and transplant and the importance that it has?
It's they haven't really, we'll write a letter to them I think this week, the next week, I'm going to write to the donor family. You don't know who it is. Um, they didn't tell me much about those. The donor people didn't really come in, and they didn't. It's just the doctors came and talked to me.
I think more the system, like we have organ donation, a system that comes into this
Yeah,
facility to on the
the harvest.
organ
Yeah.
donation side. Just the importance of supporting that, of being a donor.
Oh yeah, I think I'll give you an example. In this country, there is waiting list, but it's not like other countries. Other countries, for religious reasons, like in Greece, I have a friend who's been on dialysis he's 50 years old. He's now 64, and he still hasn't gotten a kidney. So a lot of countries, people don't donate. They don't. In this country, thank God, people donate organs um, because it makes a difference. It saves a life. Um, Somebody on dialysis can be on off dialysis. But yeah, everything has worked out for me. I'm able to walk and do everything, and it's been an experience. I didn't see any bright lights or anything like that. I did have some bizarre dreams, but because I was, after surgery,
Yes.
you're there. My family was there. It's important to have family. My daughter, school teacher, she's a counselor, but she was off for the summer, so she was there when I came home. She changed all my dressings. She had to put uh, fill the holes that were left by the surgeons with the bandages and held that. And I did have some bed sores. So had to change, help me with those, which is, grown up daughter. I said, you don't have to do this. She goes, no, it's my job. It's okay. My other daughters came. Some were a little squeamish, Dad, my wife after they left. But it's because I couldn't. We got a couch, and I couldn't stand up from the couch. So I got the things what we call those extenders underneath, and this way I could stand. They bought me a like a rocking couch. I couldn't use it because I couldn't get off the darn couch. And, I was doing this, sitting up. There's I couldn't do that. Before or after I couldn't. I was so weak. It's a big deal. It's not. People think, well, I do this every day. Get up. No, it's not. Those things I slowly but surely went through. After the rehab, the guy says, "Well, give me a sit to stand." I said, "How many you want? 10 or 20?" Because I went home and I worked out, and they couldn't believe the improvement I made. Because normally they have people who have strokes, car accidents. They don't really see much improvement, but I improved because the only problem I had was my heart.
How do you think you've been practicing medicine for 30 years? You've now gone through probably the most intensive patient experience that you could probably ever have as a human. How do you think you're going to change your approach to patients? Or
The approach is that uh, the doctors would come, most of the time when I worked, I would say, "Hey, how are you? What can I do for you?" Boom, boom. I want to spend more time because it's important to let the person tell you everything and talk and get their things off their chest and exactly what's happening. I was impressed with the follow-up. They would call me up. Your potassium is low. This is low. So the approach would be that I understand what patients are going through. I had a patient, and I reached out through one of my PAs. She has cardiomyopathy like me. I said, she's better shaped than me. She's thin, but she didn't want it. I said, if I see her, I say, why? I mean, it's sad that somebody doesn't wish. I mean, she has a, yeah, some people just don't want to have it. I don't understand. It changed my life. Before I couldn't do anything. I was a cardiac cripple, not by choice. I didn't smoke. I smoked many years ago before, but it's not a coronary issue. It's not a hypertensive cardiomyopathy. It was the way I was born. I mean, you can't change your genes, but technology did help. And I went. My cardiac index was 1.1 when I got there, which is they couldn't believe I was still walking around because I worked 2 days before.
yeah.
Yeah. So anyway, that's
So I'll open it up to any questions or anybody else have any?
oh 55, 60. Yeah. They do biopsies and they do an echo. Yeah, yeah. And my cardiac output, my wedge was 12 and my CVP was 6 every time I've done it. So the numbers are really good. Um, the heart, like I can see it on the echo, the heart really beats good. Um, everything is, but I follow the directions. I don't miss any pills. I do it, and but it's going to be a lifelong thing, right, Chelsea? I mean, it's take the pills, but what option did I have? I was is a, there's no other. So for my job is to take my medicines and make sure that I take everything I can to just like my patients, take your pills. Yes, I take a little more than the others, but what the heck? The University of Utah is one of the greatest places. Uh, they come here and give lectures. I had the reason I knew I had good we have good experience with the university. In the old days, I would call Stanford for a sick patient. They would say, "Well, we have no bed. You got to wait. Do they have insurance?" And we would fight to get the patient's help. The University of Utah, I would pick up a phone now and say, "I got a sick patient." They say, "Give us 20 minutes or give us several hours." It wasn't wait 3 days and the patient dies here. They get um, it's a great facility. It's got, they're just great doctors, great nursing. I was impressed with the nursing, the ICU, the tele-unit. They were all just great. Um, it's they do every time I saw a physician, even in a hospital, we say, "How was your nurse? What experiences? Is there complaints that you have about any way you were treated?" Every time I would get that from the nursing in the hospital. and the physicians in the hospital, and as well as an outpatient. Every time I have a visit, I get a little questionnaire uh, from 0 to 10. I always give them tens, but because I've got a good experience. So yes, they gave me a new kidney. My creatinine is 1.2 now. Yeah. Well, the heart was done on the fourth. The kidney was done on the fifth. I don't know how many hours it took Dr. Seltzman. Dr. Seltzman comes here. The irony is, I knew the surgeon because I rounded Dr. Chapman's patients when Dr. Chapman goes on vacation. Dr. Seltzman operates here, so I would follow his patients. So I knew Dr. Seltzman from the speeches here, from the talks that we have here, and from the ICU, and all the other doctors I had spoke to on the phone. Uh, two separate, yeah, procedures. Yeah. No, same donor, same donor. From what I believe, from what I was told. Yeah.
This one, I guess, to give a little bit of recovery time overnight from the cardiothoracic, from the heart
Yeah,
transplant
I
to
mean, I didn't even. I
hopefully at
mean,
least
they
lower the
kept me
risk of
intubated and did the next day. I have
yeah.
no idea. They didn't wake me up and tell me you're gonna.
Wake up.
And that was the scar here. It didn't hurt. Chapman, it had no pain. I've never had any pain. Just a little tightness, which is I don't know why. Some people have pain. I don't have any pain. Uh, a scar down here from the cardiac, from the nephrology, which is still because they must have sutured a lot of fat around it. It's getting smaller each time goes by. The swelling goes down. But yeah, it was an experience. But it was something that we see our patients all the time, and we see cardiomyopathies, but here, like I said, we only can go so far, and then I think we have to recognize, okay, when do we send them? We have a program now. We can call up the guys. We want to send you a patient, you know, um, and to work with the University of Utah is a lot easier. Yes, it's an hour flight and 8 hours drive, but San Francisco may be closer. But getting in there, this is part of our network, part of our insurance. So um, there's just they get the patients in. I said I had a patient. Let's see them. So they're very attentive and very good at what they've done over, I believe, 1,500, 1,700 hearts through since 1990. Right? They've done a lot. Yeah, they were the ones that did Barney Clark in the 1980s. They did an artificial heart. Remember that artificial heart? That was
Mm-hmm.
Barney Clark. That was at the University of Utah. So they've had experience with hearts many years. My kids, yes, it does have an effect on your children. My daughter was to be married July 30th last year. I said, go get married. She said, no, I'm not getting married without you. So I told the docs, you got to get me ready for a year from now when she gets married. And they all know that, August 20th is the wedding. They said, don't worry, we'll get you back. I told Dave, I don't know if I could walk down that aisle because it's just, but I didn't. The rehab people just brought me back. It's uh,
So April 1st, you're coming back.
April 1st, yeah.
Yeah.
Yeah, thank you. Thank you. Yeah, my patients are asking about me. I mean, we work in this hospital. We all work here. We spend more time here than home. I go home, I watch the news, I eat dinner, and then 2 hours later, I'm going to sleep. I mean, I spend all day here. So we give our lives for our patients most of our time, and and it does make a difference. Those people that took care of me, they made they did everything they could to keep me alive and to make my family feel comfortable. And for me, every time they would come in, they were very courteous. That's very important that that sometimes you get so busy seeing 25 patients that but they taught me that when I round, I'll slow down. That I'll always go fast. I'll slow and spend time and don't just rush through everything and say, maybe I should take time and until somebody's ready to tell me, okay, you're okay. That would be the difference. I would change in my approach to patients, appreciation for the doctor's time.
Well, your patients are excited to see you. We've been fielding questions since the day you left, and until literally I had somebody
Yeah, I've
ask me
got how many
yesterday.
thousand? I got thousands of patients. I've been since 1993.
Yeah.
They're good people, and I've tried to do everything. When you do everything you can for your patient, when you fight for your patient. Somebody needs surgery. I said, well, I can't get into surgeon for 3 months. I pick up a phone and say, hello, I need the patient in tomorrow. Or to give you an example, I was in recovering from the transplant, and a friend of mine who's a physician said, I can't breathe. Your cardiologist did the whole workup, everything was normal, but I still can't breathe. I said, it's not your heart, but I believe it could be your lungs. You had COVID. I'm dying. I'm dying. I said, so I picked up the phone and called Dr. Foster. I said, Guy, please see this patient tomorrow. He said, I said, this guy really thinks he's dying. I think it's not the heart. Please see him. So he saw him the next day. And the guy, I called him up. He's a physician. He says, I feel great. He's retired. But the difference a physician makes is big, but going out for your patients. And I've done that for all my patients. If somebody needs something, I pick up a phone. You got to be seen. And that's what through the years, they said a good juju, I guess. It comes around. I've been good to people. I've done everything. I've never did ill for anybody, never intentionally try to speak ill of anybody or talk bad to anybody. I'm loud, but
What's your cell number?
yeah. Yeah, it's an experience. I mean, it's amazing. You can't stand. I mean, I appreciate everything about life. Just to get up and feed myself, to get up and walk, stand. I went to Walmart and I waited and stood there for 20 minutes. And I said, okay, I couldn't do that for a long time. Uh, those are the things that it made me appreciate life a little more than before. I mean, before I could do those things, but not like now. Now I appreciate, you know, life. Every day's a gift. And what, where? Greece? Yeah, she's getting married August 20th. So I'm taking time to go. Many years ago, I chose lifestyle over money. I mean, I could have made more money being an interventionalist in lifestyle. Now I could practice. I mean, because we have the hospitalists, we have done a great job. I don't come in every other day. The MIs now are getting stented, so I don't have to come in. So as a cardiologist, I was able to practice because even when I got off the phone with the nurses, I was short of breath just talking. So I was class 4 heart failure. So I could practice further because now, in the middle of the night, the hospitalists take care of most things unless something is really serious, like arrhythmias that they can't handle. So I lasted this long because of the hospitalists being able to take care of the patients. The angioplasty, Dr. Ho getting up in the middle of the night and doing the stent instead of me giving thrombolytics. So now I don't get up, So for me as on call, I was able to last this long with because I didn't have to get up in the middle of the night and do those things. And even now, life got cardiologists. My partners in Reno are 75 years old and still practicing because it is not as was very gruesome at the old days. The internists would work up because they had to have privileges. They had to take call. So you see Dr. Aldrich up all night long, and then in the morning he had to see the patients. He had to take the no docs because he had to take all non-paying patients, whatever. Then he had to see them for 30 days afterwards. So imagine being up all night long admitting 7 or 8 patients, and then getting up in the morning and seeing 25 patients in the office. So for internal medicine, it's changed. They have a life. The medicine has changed through the years. I was on call every other day. Now we're on call once a week. Call was, everything coming in. Now it's so medicine has changed. The hospitalist program, which we had originally, we started that when I was in the old days. It's evolved to something that's really good. I mean, you evolve.
So your next trip to Greece is for a wedding.
A
right?
wedding. I'm going to leave and go. I have a church there, so I've got a church that's been handing down to my wife's. Every July 27th, they have a big festival. I got to sit there and cook for like 400 people. So that's been important. It's part of you got to do what you got to do. And August 20th, she was supposed to get married July 30th last year, but August 20th is when she wants to get married this year. So I'll be there for that.
And how many people go to these weddings?
Well, Greek weddings, they're not. It's not like here where you go and everything's fancy. And there, they have a big terrace outside the church. 500 people will show up to this one. The last one was 700 people. But it's not that. It's not the most expensive part. Is not the food. You buy 500 pounds of meat and ribeye and have the guy cut it and cook it with the rice. They make rice and pilaf, and then they make a sauce. So you buy all the tomatoes and everything, and the cooks, and they cook everything up. The most important, expensive part is the flowers. A lot of money for flowers and things like that. Yeah, but it's something that like it's cultural. Um, I invited the doctors, and then from there to come down. Dr. Drakos he goes to Cyprus every year, um, and all the folks here they know they can come anytime when I'm there. But it's what you want out of life. Some people move here to go skiing. Some people, and I tell the doctors who come for interviews, I said this is a great place to work as a physician. You have plenty of time. You want to, like, for example, you want to take 4 weeks off, you can with our program, with our group. Uh, you want to work whatever you want to do with it's it, it's what you want in life that's important. But lifestyle is everything. I've never regretted anything that I've done because I've done everything I wanted to do. Even if I died on the table, I told my wife, I've done everything. I went to Greece every year. My parents were alive. I spent time with them before they died, so I have a peace with that. So in life, you got to do what's important because what makes you happy, and that's what you know what this drove home for me. That I've done everything I've wanted to do because I've lived. Yes, I've spent a lot of time working. My kids would say to me, "You don't spend any time with us." I said, "Well, do you want me to come to your recital? I'm on call. Somebody had a heart attack. What do you want me to do?" He goes, "Okay, that's your job." I said, "It's somebody's having a heart attack. I want to be at your recital, but I was on call. Somebody had a heart attack. What?" And now that they're older, they understand that responsibility happens. We're physicians, we're nurses, we're professionals. Somebody calls you on call in the cath lab. You got to come in. Well, that's life.
Well, after being gone since June-ish, he's
Yeah.
back April 1st, seeing patients here at Carson Tahoe Cardiology. So,
And
again,
I'm
welcome
appreciative
back.
of the administration for taking me back. I said to them, I said originally, I said, wait a minute, will I have a, that was in my mind, will I have a job when I go home? They said, no, you're on medical leave. You come, when the doctors say you can come back, you can come back. So from the hospital side, my insurance plan that paid for everything. I'm paying for just the outpatient things, just like any other surgery, any other outpatient biopsies that I get. Um, the fellows who were doing it, I look up and I see a young fellow. I said, how you doing? She goes, I'm here 2 weeks. I said, go ahead, proceed cardiac biopsy. I said, okay. Because I once trained. I was once a fellow. So I have no problem with people nursing students who come in. Even phlebotomists. I'm new. Can I? Sure. I mean, uh, that's, it just brings home everything. It goes a full circle. I was a patient. They look at me, it's unusual for them to have a cardiologist as a patient going through this program. It's kind of, most cardiologists don't smoke, don't drink. They live to be 80, 90 years old, don't have heart problems. But God threw in a curve for me.
I think even when you told us you weren't coming back early on, you said you were done working and stuff. None of us believed you. We all knew it. We were surprised it's this fast. We're happy it's this fast,
Yeah,
but
yeah,
we're not surprised.
I can travel internationally after a year of the biopsy. I'm doing every other month. You can see up here are the battle scars here. They stick a needle here every 2 months now. I think it goes to every 4 months after a while, Chelsea. Yeah, but it's okay. The price you got to pay. I mean, I've had no rejection yet. I had mild, but they said it didn't mean anything. The CMV comes back positive a little bit, so I take all my pills. I go downstairs to the lab. I went Monday. I'm going back tomorrow for a CBC. It's the price you pay to live, and it helps me appreciate the patients that come to me
Mhm.
that I send for blood work, and all the renal patients that come in. And you have to feel for the patients, but it definitely experience like this. You're off for 8 months, 9 months. This month number 8 for me. It's you stay home and I read the Bible. I read medicine. There's only so much you can read and do. I try to quit watching the darn TV, but I got walk. But man, sorry I'm talking so much.
That's good. Yeah.
No.
Silent.
I read the excerpt like Dave does, just to keep up. I think it's important. It was important. At 65 years old, I had my boards. I said, I cannot practice if I'm not board certified. So I studied and passed my board at 65. I think it's important to keep up and to read and because you can't be expected to treat patients if you're not certified, if you're not the expect standard of care. And I try to read every day and because I don't want to provide care if I am not qualified to provide care. So for me, it's important to read and keep up and because look at the books, even the books that I was reading before, they're obsolete. Within 2 years, everything has changed. So
Well, again, so unless there's any other questions, after 30 years of practicing here and a 8-month absence, we love having you back.
thank you very much. I really
So,
appreciate it.
thank
Thank you. Thank you very much. Thank you.